All righty, let's go ahead and get started. Hello, and thank you so much for joining us today on this behind the scenes webcast, Community Beyond Shelter with Anti-Cruelty. We're so excited to share this incredible discussion about the many ways that we connect with our community and beyond. Before I hand over the webcast to Darlene, our president, I'd like to do a little bit of housekeeping. Please engage in the chat throughout the webcast with our speakers and attendees. We'd love to hear from you during the discussion. That is also the perfect place to ask questions, so please feel free to pop any questions you have during the discussion into the chat function. If you're experiencing any technical issues, please try refreshing your browser or try refreshing the Zoom app, as well as confirming that your volume settings on your device are up to date and set up. If issues persist, please restart your device and rejoin the Zoom. A link to the recording of this webcast will be provided within 24 hours. I'll also be sharing links in the chat with more information about the programs and issues discussed, so please keep an eye out for that as well. All right, I think that's everything. Let's go on with the presentation. I'd like to hand this webcast on over to our president, Darlene Duggan.
Thank you, Allison, and welcome everybody. I will echo Allison's graciousness for your attendance today. Excited to be speaking to you today about all of the ways that anti-cruelty supports the community and how community in general is moving in organizing with the shelter. Just a brief recap here about Anti-Cruelty Society. Our mission is to build a healthy and happy community where pets and people thrive together. That has been Versions of that have been our mission literally since 1899. So it's nice to see such consistency with the work that we do. Again, speaking from the sheltering aspect as well as from the community side of things. Next slide, please. Our long-term vision is to build a humane Chicago for pets and people. So you'll see, even in our mission and our vision, this connection between community and pets. Next slide. And what are our guiding principles? How do we do this? The two pillars that we stand on to deliver our services and our services to the people are best care, in that animals deserve the best care. And that is more than just a concept or just a phrase that we say. This is actually written within our SOPs. We're always looking at our protocols, our procedures, and making sure that we're achieving both best care from our internal perspective, but also making sure that we hit the mark on guideposts that are within our field as well. And we will have always been and will remain an open door, welcoming all pets, all people into our organization. And can you take us to the next slide, please, Allison? Wonderful. Okay, so this is the exciting part of our presentation. You'll get to hear today from three of my esteemed colleagues. Lydia is our Vice President of Mission Impact. Dr. Hampton is our Manager of Community Medicine, and Dr. Emily Swinarski is our Medical Director. And the four of us today are going to tell you and talk to you about the ways that anti-cruelty is reaching further and further into the community in order to bring the services that are needed to the community, but also see that overlap of sheltering and the community as well. So to get us started, Allison, if we can move to the next slide, please. To get us started, I just wanted to set the stage slightly. As we've been talking, there has been a shift in our approach to sheltering towards a community-driven method that recognizes animals, our pets, are part of a larger system of people, of animals, and the environment. And I specifically chose this image here to talk about. I think we all have that iconic image of the dog catcher in our mind when we think of animal sheltering. And certainly in those early days of animal sheltering, that's what comes to mind. And so it was more of just a stray dog cat roundup. There was probably a little bit of adoption that was happening at the time, but for the most part, it was just get the animals off the street. And as time progressed and as we moved on through the decades, essentially, we got a little bit more sophisticated sophisticated in how we approach animal sheltering. Previous models like this are simply addressing the symptom, but not really addressing why that symptom is happening in the first place. It was essentially a Band-Aid that was put on the process, and that was it. And so now we're starting to move and realign ourselves with a more holistic approach, which is not surprising when we consider the rapid increase in the quality of animals, or essentially the place that animals have in our family life. So if we can move to the next slide, please. Through the years, we started to address spay neuter, realizing again that the symptom of having so many animals on the streets could be addressed through simple spay neuter approaches. And so looking at this graphic, this is one example. I'm sure many of us have seen others where it shows kind of that exponential growth of just one female cat that is left unspayed. So essentially what this is telling us is that one female cat, her progeny can reach up to 400,000 based on that exponential growth. So it was clear to animal welfare, our animal welfare predecessors, that this needed to change, that we had to address this overpopulation project. So in the 1950s, 60s, 70s, we started to realize that spay neuter of both the animals on the street as well as those animals in our homes was critical to combating the overpopulation issues. So next slide, please, which takes us to a little bit more modern times. And here you'll see these are our field service agents working with the community to address the community sheltering needs. And so previous models of animal welfare, there was an animal or a dog or a family struggling to maintain or keep care of their dog. They would have called the shelter. We would have taken it into our intake account and possibly rehomed it. But now we're working with those people and we're saying, okay, what exactly do you need to help this animal be successful in your life or in your home? And so here we're just showing an example of our field service. We brought a dog house out to folks who wanted to provide a little bit more shelter for their animal in their backyard. Next slide, please. And this is kind of a fun connection between this realignment, again, of this more holistic approach to animal sheltering. And you'll notice that this is kind of in alignment with the status of animals in our lives. In the 1940s, we had the iconic character of Snoopy, who had a dog house outside. He didn't really spend much time with the family inside. He didn't really interact with the family all that much. He had his little bird friend, but that was kind of it. He didn't really speak. He didn't have a speaking role. Moving the needle forward into the 1970s, we see Scooby-Doo. Now, Scooby-Doo is a little bit more part of the gang. He mumbles, he kind of talks a little bit as well. He is a little bit more at the forefront of that family unit. And then taking that into modern times, we see this is the character of Brian from Family Guy. And Brian is a sophisticated dog. He stands upright. He drinks martinis. He sits on the couch. He has his own bedroom with the family. He communicates with the family in English. He doesn't bark. He doesn't do any of those typical kind of dog things. So even looking at the progress of animals in pop culture realigns with this concept of shelters moving more into the community, because pets are becoming more and more important to the family unit. So taking things from here, I would like to introduce you formally to Lydia Krupinski, who is going to speak to the work that we do in the community to support this human-animal bond.
Awesome. Thank you so much for that introduction. Hello, everyone. It's so great to be with you this afternoon, and I'm thrilled to be talking about this topic because, as Darlene has shared, there has been so much evolution in how we think of animal sheltering in the present day and age. And as Darlene shared, we have a legacy at Anti-Cruelty of helping both pets and people through the field service programs, through our humane education initiatives, even through volunteer mobilization. Our founders themselves were volunteers, and so we're always leaning into the community to make sure that we can be exponentially growing the impact that we can provide to the animals and people throughout Chicagoland. And so as you see on the slide in front of you, the concept of community care really builds in and interconnects with our mission as an organization. And Darlene, I don't know if you had a few words along these lines as well, because I think that the next slide may belong to you. If we can go to the next slide, Allison. I think this one is mine. Thank you. So with the Community Care Initiative, this is an opportunity that we brought forth during the pandemic when we saw that there was this increased need to help people preserve the human-animal bond. Prior to that, at around the 2008-2010 mark, as Darlene was showing in her cute cartoon graphic, we started really enhancing our safety net program so that we can keep pets in the homes of the people who loved them. And so since that time, we started to really, I would say in a gentle way, expand some of those safety net services, but the pandemic made it even more apparent to us that those services were needed more now than ever. And so the Community Care Initiative was formally established in 2021, and this entire department is devoted to helping to preserve the human-animal bond by providing resources directly to the pet owners. And so there's really 3 tiers of work that the Community Care Division is focusing on. The first is to preserve families, and that's by providing safety net services either directly or through referrals internally for anti-cruelty programs that we have throughout the organization or externally. The second, Allison, if you can click the slide again, is closing service gaps by bringing pet care resources directly to the community. Part of our understanding as it's evolved over the last couple of decades is that there are all these pet owners throughout Chicagoland and beyond who do want to keep their animals, but there's a variety of barriers for them to accessing the services that they need to keep their dog, cat, rabbit, and other critters in the house. And so closing the service gaps by providing transportation, by providing translation support, by providing stipends and other resources to help keep pets in the home is part of the work that we're doing. If you can click again, Allison, the third tier and pillar of what we do within the Community Care Initiative is to cultivate compassion. And I'll pause. I'm in the shelter, so you'll be hearing a little bit of paging here and there. So the third tier here is to cultivate compassion by using a comprehensive community-based approach. And Darlene hinted at this. It's not just us going out and providing services to the community. It's really partnering with the community throughout all of our departments and all of our services so that we can work together and to ensure that the services that we're providing are being brought forth in a dignified, respectful, collaborative way. Next slide, please. So this graphic is a very, I would say, detailed depiction of all of the programming that we provide here at Anti-Cruelty that's community facing. And you'll see that there's a lot there. And the reason why we like to show this graphic is it really shows the breadth and depth of the work that we're doing. You know, we could be focusing on just one demographic or one sliver of the pet owning population, but we see that people in all walks of life at some point may need some support from Anti-Cruelty or some of our partners. And so that's why we really look from the perspective of providing whole family support through the community care initiatives. And so we have a very robust portfolio. If you can click again, Allison, we should have a list of services and programs specifically provided throughout the community care initiative. So those include our pop-up pet pantries, our wellness fairs, which provide important preventative and vaccination opportunities within the community, and those travel throughout Chicagoland and nearby suburbs. We have our Pets for Life program, which is specifically focused in Roseland, and that's an initiative that does door-to-door in-reach to connect with people at a very one-on-one level to see what services might be needed. We have the SAFE program, which has been part of the portfolio since 2008. That was originally founded as an initiative to provide emergency housing to the survivors of domestic violence, and has actually expanded to provide support for folks going into treatment or hospitals and who may be facing temporary issues with their housing. And so the SAFE program is a part of the core services that community care offers. Friends Who Care, that's our senior support program to ensure that individuals who have pets can keep them, even if they're having difficulty maybe providing food. We provide direct delivery to their home so that they can make sure that they can keep their cats, dogs, and other critters in their household and in their family. We have the Pet Support Fund. This is an initiative that was launched during the pandemic as we saw that there were all of these outlier needs that were preventing people from keeping pets in their home. And one of the services we provide through this is our pet deposit subsidy. Someone may be looking for pet-friendly housing, which we know is a challenge in Chicago, and they may find that that miracle spot that allows their large breed dog, for instance, and maybe they're just a few dollars short of making the pet deposit to be able to secure that housing. So our Pet Support Fund helps to bridge that gap. And then we have the last two things on this list, our behavior helpline and care navigation. That is our team hopping on the phone or being in an email and providing people with customized support to help them find resources in their area if they don't live locally, or providing direct behavior advice on things that they can be doing to retain their pet rather than giving them up to a shelter like ours. So with all of those programs on the community care side, we think of them as in two buckets. One is responsive programming, and those are programs that assist with a client's immediate short-term needs. Those examples would be the Pet Support Fund, or perhaps the SAFE program, where we're saying, hey, you're in a tough spot and we want to help create some resources to help you keep your pet until you kind of get onto the other side of this crisis. And then that second bucket is proactive programming, to really be diving deeper into relationships with individuals or with entire communities to ensure there's longevity of pet care ownership and quality of life services. Next slide, please. So some stats to show you that I think will help to depict what the breadth of this programming is. You can click on this twice, Allison. So these are numbers from our 2023 fiscal year. We're actually coming up to the end of 2024's fiscal calendar for anti-cruelty, so we'll have updated stats soon. But in 2023, our goal was to provide support services to 1,500 animals through our community care initiatives, and we actually surpassed that goal significantly and provided support to 2,700 pets. And you can see in the breakdown what that looks like per program. And then Allison, if you can click again for me. Then we also show on this side what that looks like in terms of people assisted, right? Because again, you saw in our mission statement, as Darlene was sharing, it's all about that connection, that human animal bond between pets and people. The history of animal welfare is providing support to the animal. And as we have been sharing throughout today's gathering, it really is about that intersection. We can help more pets if we connect with more people. And then that's where we really start to see that exponential growth and that humane Chicago building. And so in 2023, we saw over 4,400 people engaged through our community care initiatives as well. And then you see at the bottom there's a few highlights of different programs that we really last year expanded on: our wellness fairs, our Pet Support Fund evolution. We're thrilled last year to start doing some collaborative work with an agency that provides virtual dog training for people who are experiencing issues with their dog or cat's behavior, mainly with the dog side, to make sure that they can retain the pet. We received an award through the Humane Society of the United States for our Pets for Life work. And then we saw a lot of collaboration between the community care team and, as you'll be hearing in a second from Dr. Hampton and Dr. Emily, our care clinic, which has been expanding significantly. So with that, I will hand things back to Darlene.
Thank you, Lydia. So much going on that side. Quick question for you: with all of the programming and all of the services, and hearing you kind of articulate the details of all of that, what is the unifying piece amongst all of that? I'm imagining if we see a pet at a pop-up pantry, or if we see an animal that needs support from a pet deposit kind of perspective, is there any way that we see that additional services that are being met? Where can you speak a little bit about, kind of that link between all of the pieces that they need?
Yeah. So that's actually a great question. So folks can access our services from a variety of, I would say, entry points. That could be through phone call, through email, or showing up at one of these events like our pop-up pet pantry or wellness fair, as you mentioned. And so the beauty of having a devoted team that works for and with the community is that when somebody engages at one of these events, our community care staff will then provide follow-up and ongoing support. So if we have somebody who comes to a wellness fair and perhaps their pet is showing symptoms of an illness that maybe we can't treat at the wellness fair or needs additional diagnostics, we can put them in touch if they're, let's say, in Roseland with our Pets for Life coordinator, who could then arrange for transportation to our care clinic to have some additional diagnostics completed. And so that one of the most crucial things that we've been hearing from the community, because this year we've been completing a community survey specifically in Roseland through support with the University of Wisconsin to get additional information on like what are the greatest needs in this specific community when it comes to animal care. And the thing that we've been hearing most is what we've now described as care navigation. So it's this concept of like, hey, I'm a pet owner, I have this specific need, but it's probably not the only need I have for my animals. And so what other services can we provide and or can we refer out? And so that's what the community care team really takes a lot of time to do, to see, okay, what else is needed? You know, are they finding themselves low on pet food at the end of every month? Or is there a transportation barrier that's keeping them from having regular veterinary care and so forth? And so our team gets to do that deep dive, and that's where the depth comes in and not just the breadth. So we're reaching out across Chicagoland, kind of on this, I would say, at a more surface level with some of the preventative programming like the wellness fairs, but that allows us to go deep with certain clients who need the additional counseling and support.
Yeah, that's amazing. And that then, when they need that depth, certainly medical always comes up, whether that is preventive or, addressing an urgent need. And that's where our care clinic comes in. So I would like to introduce Dr. Hampton to speak with us a little bit about the services and kind of the experience on the care clinic side that ties all of this work together.
All right. Hello. Just give me a thumbs up if I need to talk a little bit louder. I'm Dr. Hampton. I'm the manager of community medicine here. I've been at Anti-Cruelty for probably a long time, 10 years total. I was here for 7 years working on the shelter side before a brief hiatus and returning kind of in my current role. And one of the primary tasks that kind of Darlene assigned to me was, getting our outpatient operation restarted after a brief pause during the COVID period. We weren't seeing a whole lot of outpatients. And so you can kind of see in this picture, this is us at one of our wellness fairs. And this this kind of demonstrates, again, more to what Lydia was saying about how we're so closely integrated with different departments in our organization. So the care clinic, we provide a good portion of veterinary staff into our wellness fairs. We provide vaccinations, flea and tick prevention, examinations, even we're even able to schedule clients for appointments. And it's another photo just demonstrating what we're doing at our wellness fairs. And we can go to the next slide because I kind of want to talk about the primary goals of the care clinic. And, the care clinic is essentially our outpatient operation. So you kind of think of it as, your friendly neighborhood, small animal practice, with very specific goals. Though we're not here just as clearly not a profitable purposes. Our main goals here are to create a sustainable clinic model. So we're not trying to make money. We just don't want to dig a big hole for ourselves, but we really want to focus on addressing access to veterinary care. And the issue of access to veterinary care is one that has been present, in veterinary medicine for a long time, but has become much more prominent and something that has kind of garnered a lot more attention more recently. As we become more aware of the reasons that people can't access veterinary care, whether that be financial, whether that be location. There are significant portions of the city of Chicago and surrounding suburbs that, are very limited in the number of veterinary clinics that are available. And you can imagine if you don't have a lot of veterinary clinics in your area, again, appointments are going to be less available. Prices are going to go up to try to match that. So we've really focused on kind of addressing the access to veterinary care issue in a way that's consistent with our open door values. So really trying to say yes to clients. So if you kind of refer back to that previous slide, you can see the picture of me holding a cat. We do not see cats at our wellness fairs, but the client brought cats and we happen to have cat vaccines. So for that client, we said yes, even though it's not something kind of core to our wellness fairs, we were able to help them out. There because there are so many barriers to accessing veterinary care, we're not able in the care clinic and through our operation to eliminate all those, but we want to eliminate as many as possible while also focusing on our staff's well-being to make sure that our staff can all be here for the long run to provide care and support the anti-cruelty in our care clinic operation long term. So if we go to the next slide, we can kind of talk about some of the barriers that we removed to try to help improve access to veterinary care. So one of the things that was really important to me when I came back previously, when I was working on the shelter side, we did have a low cost clinic because the anti-cruelty, for those who don't know, has one of the oldest charity clinics I know in Chicago. I'll even say the nation. That may not be true, but I'll claim that we've had the first charity clinic I think in the 1920s is when we opened up. So really, what we're doing now is a continuation kind of that mission that started back very close to our founding as an organization. But when during my previous stint anti-cruelty, we there was means testing, so clients who wanted to access our low cost clinic because our prices were so significantly discounted thanks to the generous donations of all our donors. You know they were you had to qualify to access the clinic. We've eliminated that, and the main reason for that is because we don't want to be providing judgments of clients. Dr. Kwame Stewart founded a program called Street Vet in the West Coast where he's providing care to people who are homeless and homeless animals. And his slogan was no judgment, just help. And that's something that really resonated with me and resonates with our program. If people are coming to us asking for help, we really just want to say yes. It doesn't matter, whether you're from a chronically disinvested neighborhood or a disinfected demographic, or whether you just kind of fell on hard times in the last few months. We want to be able to help as many as people as we can. So removing that means testing is one way that we did that. We also increased staffing. We now have a department of 4 people, one of whom started today. So we're growing, and that's really going to help us provide more care, work more efficiently, and really be able to get more clients in. We've increased appointment availability, offering a variety of appointment types just so that we're able to fit more clients in, so that we're able to deal with the clients who are coming in for something sick that's going to need a significant time investment for our staff, and also being able to at that same time fit in a puppy who just needs his 3rd booster shot so that he can go outside and play in the yard. The other barrier that we're removing is by providing financial support for clients, and we're doing this in a lot of different ways. We have our services and fees that again are steep, are targeted below market rate. So our price is significantly cheaper than what you would find at your average brick and mortar private practice. We also have payment plan options. So some clients, it's not necessarily the amount of the bill. They have a cash flow issue. So if you can spread that payment over a period of 4 to 6 months, they can make that without a problem, as opposed to having to have this big $500-$600 bill all at one time. So the payment plans have also really helped kind of expand what we're able to do for clients and clients we're able to serve. And then we also have different ways that we can completely waive fees for clients. So the Pets for Life program that we're doing in partnership with the Community Care program. There's other grants like the AVMA Reach grant, which is a kind of one-time grant offering that we can apply for to cover, clients who have had like an urgent need or urgent illness in their pet. So there's a lot of different ways that we're able to really provide financial support. We also we do our best to make our plans and options tailored specifically to the client's needs. So if a client needs, if there are diagnostics that we would recommend and prefer to have, but the client is not able to perform that, we operate on a spectrum of care. So trying to figure out how we can best match up the client's needs with the pet's needs and the medication that they need. And so if we go to the next slide, we can kind of look at a quick timeline of kind of how, since I've been back, kind of where we started. So in February 22, the Care Clinic, we kind of officially reopened. We weren't 5 days a week. It was mainly me on days I was available, offering appointments to clients and getting them in. And then June of that year, we hired our first staff member. That was our community medicine vet, Dr. Sorensen, who, besides providing support for the care clinic on site, was also providing veterinary support for our other partner organizations. Part of another one of Darlene's ideas, the veterinary hub, which that may be a second follow-up insider meeting. Um, after that, we followed by the following year in April, we upgraded to new practice management software that really improved our ability to schedule, to keep track of our charging. It is just much more modern practice management software than we were using before. Um, in June of that year, we hired our first official dedicated support staff. So again, the care clinic is very closely integrated into a lot of the different departments within our organization. So we would share some of our staff with shelter operations and spay neuter operations. So we were able to again continue to expand the services we're offering by having somebody who's completely dedicated to our program. And then November of that year, we transitioned to being open full time, and piloting our first, our program to fully open 5 days a week, providing veterinary care with our doctor here. July of this year, we actually hired our second community medicine veterinarian, who is again Dr. Lily Johnson, who has really added a an increased capacity for our program, so we're able to see more clients, we're able to help more people and provide more surgeries. And then also in this year, we upgraded to online scheduling, so now clients, instead of having to contact our reception team, they're actually able to go online and schedule appointments for themselves, and that really allows us to again function more efficiently, less staff time focused on scheduling, more time focusing on caring for pets. And then if we go to the next slide, there's just a few few numbers of what we've done this year. So year to date, we've added 1,100 new clients. We've completed over 1,500 examinations. X-rays, we've done over 150 X-rays for clients, over 200 surgical and anesthetic procedures. And these are anything from urgent to emergent issues like pyometras and foreign bodies, to routine preventive maintenance like dental cleanings and tooth extractions, all and everything in between. So amputations, enucleations, which means removing a diseased eye, mass removals, all that kind of stuff. We've dispensed for $55,000 worth of medication, and to help support pets and their care. And I think that's all. Yep, that's all of mine.
Well, again, thank you, Dr. Hampton. There is so much, and it's hard to believe that our care clinic is focused mostly on just wellness and urgent care. It's not even fully, a full comprehensive veterinary procedures. We do partner with local experts for animals that might need a little bit more above and beyond care. But can you speak to us? So you've been with the anti-cruelty for quite some time now. You've been a veterinarian for quite some time now. What is it about the care clinic in particular that kind of keeps you in shelter medicine and that keeps you coming back and keeps you moving forward?
I think the main thing for me is just being able to say yes to clients, because we end up seeing so many clients who are just in desperate need of care. Who usually, when clients come to us, we're not seeing a whole lot of the clients at their first go around with the veterinarian. Typically,
Mm-hmm.
we're kind of these clients' last stops. They've been to multiple other places. They've kind of exhausted all their resources, and they're no longer able to really afford any further veterinary care. So being able to say yes to them and figure out ways to help them, I think is really what helps fill my bucket.
Mm-hmm.
Is being able to again having that flexibility and that freedom to say yes regardless of the client's ability to pay.
Yeah, I think it's pretty incredible. And again, I think anti-cruelty has always been on the, so to speak, cutting edge of integrating the community into the sheltering work that we do. And it's so exhilarating to be a part of a team that is continuing to push that into our mission and our vision for the future of animal welfare, certainly the future of our community. So thank you. Thank you for kind of giving us such a great overview of all the work that is happening there and all the impact that is happening there. I want to kind of turn things a little bit here and introduce Dr. Emily Swinarski, who is our medical director. And Dr. Emily is going to speak to us a little bit more about spay and neuter. Earlier in the presentation, I did mention that kind of one of the pieces of the evolution within animal welfare was to recognize the power of spay neuter and how that has shifted and changed our community relationship as well. So, Dr. Emily, can I turn things over to you to tell us all about high volume, high quality spay neuter?
Yes, absolutely. My
Yeah.
pleasure. Hello, everybody. Glad to be here. I just want to touch base on, not just spay and neuter, but implementing high quality, high volume spay and neuter. So what does that really mean? It's got a long acronym, HQHVSN, but the emphasis is on quality. So while we recognize a need for spay and neuter in the community, and we are going to have a higher volume of spays and neuters that we can do, we always ensure quality, and it is a specialty of its own. There are veterinarians and veterinary clinics, including ours, that basically specialize in nothing but spay and neuter. And so coming out of veterinary medicine over the last 20 years, this is an arm of veterinary medicine that's a specialty all its own. This was established in general about 50 years ago. It really became more popular and gained more traction in the last 20 years. And more than 50% of pet owners cannot get veterinary care primarily due to finances. So when we talk about access to care and what the care clinic is doing, Dr. Hampton is looking at the entire patient and focusing on individuals. We also have to look at our community and their spay neuter needs. And most of our community cannot afford or has trouble affording or accessing spay and neuter services at routine veterinary practices. So what we do here at Anti-Cruelty is we specialize in spay and neuter. We operate at a lower cost because we have more patients coming to us. So we are increasing access to care. Spay and neuter is essentially a part of care of animals that they wouldn't otherwise necessarily have. So we are one team. We may have two different primary functions, but we work very closely hand in hand. Next slide, please. So this is a very long quote, but I wanted to highlight something. That while we talk about spay and neuter and we're thinking about community members, we're also thinking about the shelter. So Anti-Cruelty provides spay and neuter to all of our shelter animals, cats, dogs, and rabbits. But we also want to think about the health of the animals that are coming into our shelter and trying to prevent some of the animals from coming into our shelter, in the sense that Kelsey Weisenberger, who's our animal resource manager, she sits up there in the lobby when people come in and say, I'm at my rope's end for a variety of reasons. I have a pet that I need to relinquish. What Kelsey said was one of the most common reasons that owners of kittens and puppies give for surrender is that their resident pet had an unwanted litter. So if we think about spay and neuter and how it ties into shelter medicine, how it ties into care clinic, we want to prevent intake into our shelter and, really focus on the animals that otherwise really, really need us. So spay and neuter is an essential part of all of what we do. Next slide, please. So essentially, we've also kind of looked at shelter medicine as a whole. How has it approached high quality, high volume spay neuter? And a lot of people are a little bit, when they hear high volume spay neuter, they think, well, if you're not focusing on the individual patient, is that going to be dangerous? And why would you need to focus on that? Is there a need for spay and neuter? I think outside of shelter medicine, it can be hard for people to see that there's such a need, but there really is. Back in 1973, when spay neuter clinics first started coming about, there was an estimated 13.5 million animals being euthanized every year in this country in shelters throughout. But in 2019, prior to the pandemic, we noticed that there was a significant decrease year over year of how many animals had to be euthanized in shelters. Well, we can't say that that's just because of spay and neuter. We can absolutely attribute that in many communities, as well as ours, that the number of shelter animals that has to be euthanized has decreased, which is a great thing. And during the COVID-19 pandemic, there was an issue, right? people were locked down, clinics were closing, and we actually saw a decrease in the number of veterinarians and other technicians and support staff who were working at that time. And there was a sharp decline in how much spay and neuter was being done. Because of that, there's a study that came out from a big group, including the University of Florida, that estimated that during that pandemic, we fell short 2.7 million surgeries that would have been done on dogs and cats during that pandemic. So we kind of focus on this fact that spay and neuter is part of access to care, but it's also become something that shelter medicine needs to keep on top of our intake. And now we're seeing a significant decline. So it's more important now than ever that Anti-Cruelty look at this and continue to provide high quality, high volume spay neuter. Next slide, please. And lastly, I just want to, continue to highlight that, the quality is there. We have done 3,000 spays and neuters in the past 12 months, but we know that this team has been receiving specialized training over the last year, including a consultation of a specialist that came to the shelter. We know that we can continue to actually increase our volume, but maintain quality. For example, there was a very big study that came out just a couple of years ago that talked about how when you look at private practice and their spays and neuters, and you look at a high quality, high volume spay neuter practice like ours, they actually found less complications in animals, meaning that animals do better overall through spay and neuter in a high quality, high volume spay neuter program. And that's because we specialize in it, right? Our vets know how to do it. They do it quickly. Anesthesia is less time, et cetera, et cetera. There are many reasons for it, but I'm positive that our team not only brings quality, but can bring even more volume, and that's exciting. We currently cannot meet the needs of our community. We have people signing up for spay neuter. Our spots always fill up. And to me, there's never an open spot. That means our community wants more. We are always going to provide best care. Even as we increase volume, our focus, our training, everything we do is focused on quality. And again, we want to continue to prevent intake, knowing that during the COVID-19 pandemic, the entire nation's community, things slowed down for surgeries. We want to make sure that we continue to keep elevating our numbers of surgeries to help our community and prevent intake long-term. And that's all I have for you today. Very brief overview of a very big topic.
Wonderful. Thank you for that, Dr. Emily. Yes, that is a very big topic. And I think it's important to point out that the focus is on volume and equally on quality. Just because volume is increasing under the HVHQ model, it does not mean that quality is suffering. The doctors and technicians and the logistics of the entire operation are still focused on quality. I think we have kind of a big event coming up in a couple of weeks. Do you want to tell and talk a little bit about what's happening in November for us?
Yes, I would love to. So we have an event, we call it Snippet Forward Spay Neuter-thon. Essentially on Saturday, November 2nd, we are going to be able to provide 80 spays and neuters to our community all in one day. We're relying on our very talented staff. We're relying on our amazing dedicated volunteers. And we even have a couple different hospital partners contributing some team members as well. And in this day, we're going to be able to provide a lot of services towards our community cats. So cats that are free roaming on the streets, they need spay, neuter, and vaccines as much as any other pet would, as well as pets in our community. So we're very excited to offer this to the community in just a couple of weeks.
Yeah, absolutely. And it's going to kind of be a little bit of a celebration, a kickoff, of anti-cruelty, starting to, or continuing, I should say, to address these issues that we've seen that you spoke about, the deficit from COVID period, as well as just the high volume addressing. So thank you so much for that. We are kind of at a point now where we can take questions from our attendees. But before we do that, I do want to just give a special thank you to all of those who support all of the work that we do. None of this would be possible without our humane heroes, without our Rose Fay Thomas Society members, without our monthly sustainer donors, general donors, our partners, our friends, our general supporters. The work that we do and assembling with a team of experts and experienced folks such as Dr. Emily and Dr. Hampton and Lydia, and all of those who are not joining us on this call today, would not be possible without the support of our community on the other end of the spectrum. So I realize that this is such a continuation, such a circle of, the community donates to our organization, and then we're able to take that funding and put it back into the community to continue to help animals and help people. So just want to give a special thank you to all of those folks who support us in those many, many ways. So Allison, if we can go ahead and open up to any questions from our attendees, I'm sure the team would love to discuss even further.
Yes. Hi, everyone. Please feel free to pop any questions that you have in the chat. We are so excited to answer any of those questions. We have Barbara Provost saying that she is so proud of all we do, which we are so incredibly grateful for. So if anyone has any questions, please feel free to pop them in the chat, and then I am happy to help facilitate that. While we're waiting for some questions to come in, I'd love to hear kind of what you might find is the most enlightening thing you've learned from this presentation from your colleagues. Was there something specific that really stuck out to you and made you feel like, oh, that's so interesting, that's a good thing to know?
I am constantly inspired by the folks on this screen, but just the other 130 or so employees that we have at Anti-Cruelty. And it's daily, Allison, I think, that we hear incredible stories of life-saving and life-giving and just kind of reunification of that human-animal bond and supporting that human-animal bond. And as we said earlier in our session, I am new to this president's position. About 2 months in now. So one of the perks, I think, of getting this job is that I can upgrade my office to the office next door. And for those who have maybe had a webinar with me before, you'll notice that I'm still sitting in my former office because I love it so much. And one of the reasons being is that my windows overlook the courtyard. And today it's raining, so I don't have the windows open today. But normally I do, whether it's 95 degrees out or it's below zero. I love to keep those windows open because I can hear, that's our courtyard where folks are kind of visiting with dogs and, testing out the waters and finding a good match. And I can hear our staff kind of talking through the adoption process. And for me, that is what motivates me to keep going and to keep working hard and to keep pushing ourselves so that we can help as many animals as we possibly can. But also that is the point that I get to hear families being made. And I don't mean to be sentimental about that, but all of the kind of not so nice stuff that we hear on a daily basis or that we see on a daily basis working in an animal shelter, because there's that aspect of the work that we do too, is negated by the sights and the sounds and the celebratory tones and the barking and the excitement that just is outside my window. And that, I think, is the piece that when I hear all of these stories from our clinic and from our community team and from all of the areas that we do our work, that keep me going and keep me motivated. And if there was a way that I could bottle up that courtyard energy, I would, and we would sell it or we would give it away or we'd find some way to share it with the community, so that everybody, supporters, generous donors, staff, volunteers, everybody could see the fruits of our labor in that way. So thank you for asking that question.
Wonderful. Barbara wants to hear a heartwarming story. Dr. Emily, Dr. Hampton, Lydia, any of you have some wonderful stories about our community programs or wonderful things that our clinic are doing.
Yes. Tell me.
Always. I'm sure Dr. Hampton has another variety of stories. I can give a quick one, is only that we have seen owners that come into us. For example, an owner brought a very large breed dog, an intact female, so had not been spayed, girl dog. And she came to us with an infection inside of her that could only be removed by spaying her. But the expense or the cost of getting her spayed at another veterinary clinic was so high for them financially that wasn't going to be able to happen. And dogs can't live with that infection. It's called pyometra. So knowing that from Kelsey at the animal resource specialist all the way down to our spay neuter clinic to get this dog spayed the next morning, and back to her owner, because we're not interested in disrupting that human animal bond, but we're here to support owners in every way possible. So even through spay and neuter, we do see clients that really need that access to care.
Great. Dr. Hampton? What?
So I don't know if it's no particular one. We get a wide assortment of clients and animals with all kinds of problems that that they need our attention. But I think the main thing that I think gets me is just how appreciative so many of our clients are that we're here and able to provide these services. I can't tell you how many times I've had clients who say that they don't know what they would have done if we weren't here, or they were thinking about euthanizing their pet because they just couldn't find anywhere where they could afford care. I've had one client who was a senior, and she had 5 dogs, 2 of them intentionally, 3 of them happened to be the children of the other 2, and one of them she had all kinds of problems. One of them had a heartworm positive, so heartworm disease. None of them were spayed or neutered. One of the puppies had a foreign body. And so she had all these cares and all these issues that she had to deal with. And I think that it was just beyond her, capabilities to address. So we kind of triaged through her crew, the dog with the foreign body. We were able to get in very quickly and help remove that. He had Lilo and Stitch, like the little stuffed Stitch head stuck in his intestines. We were able to get that out. Working with Community Impact and the Pets for Life program, we were able to get her other animals spayed and neutered so she wouldn't have any more puppies. So, situations like that where clients really have a big need that only an organization like Anti-Cruelty, with so many different arms and so many different programs and departments, are able to really give a comprehensive way to kind of address these clients' problems.
And actually building off of that, I have something that ties it all together. In our opening, Darlene shared how we're committed to providing best care for people, for pets, and we've been talking about that throughout this last hour, but also in communities. And one of the things that's really incredible about all this work that we're doing, as Dr. Hampton described kind of throughout the Anti-Cruelty Society, is all of this work impacts communities. And one fantastic story of this is we have a woman who, by the name of Ramona Lewis, who brought her dog Coco to a wellness fair back in 2021. And Dr. Hampton, he knows, he knows Ramona. And she brought her dog Coco, was already a very, I would say, active member of her community in terms of advocating for pets in that space where she lived. And she's right outside of Roseland and Pullman, or Pullman's part of Roseland, but she's in that region. And she came to the wellness fair, made an immediate connection with our team, and was like, whoa, look at all these incredible resources Anti-Cruelty is providing for pets. I know a lot of pet owners in my community who could benefit from these services. And so Ms. Lewis has become an anti-cruelty advocate in her community, an advocate for the pets in the community, and an advocate for the pet owners, and stringing it all together to the point now that she brings and helps to transport other people's pets to wellness fairs. She does dog walking for some of the animals in her space. And so through that, she provides a lot of referrals to our care clinic and to our Pets for Life program and through other resources that we provide. So this one individual being able to connect with one of our programs has led to this incredible kind of expansion of services, not just to her dog Coco, but to her entire little ecosystem. And so that's really the beauty of this community work and getting it outside of the shelter walls and out with boots on the ground.
Yeah, and that's such an important lesson, I think, that we have learned, or certainly that I have learned, is that it's not just the layer of anti-cruelty staff and volunteers and advocates providing the support for the communities, but it's enabling the communities to provide the support for themselves, so that, you know, they're not dependent on anti-cruelty, they're self-sufficient. And so I think that's a very important component of the work that we do. So I love seeing that. I love hearing those stories and seeing that play out in real life. So thank you for sharing that. If there aren't any other questions, Allison, I know you're keeping your eye on the chat. I just, again, wanted to iterate my sincere gratitude for those who are joining us today, but also for your extended support for the work that we do, and it's felt here on a daily basis. And we definitely see the impact that your support is making, and it's an incredible thing to see. If you are not someone who joins us in the shelter or you know, at our events on a regular basis, I certainly extend an invitation for you to come in and see firsthand the work that we do. We're an open door, and we're an open door in all aspects of the term. So would love to see everybody here. Please reach out to us and let us know, and we'll arrange a visit for you to kind of see a real behind the scenes tour of our work in action. I do want to mention as well that we have our next seminar webinar coming up on November 12th. The topic of that is going to be around estate planning, which is, again, a very important piece of the work that we do to make sure that we are able to continue this work, you know, through the decades. Like I said, we've been around since 1899, and we want to continue to be around in the future. And so join us again on November 12th for that next webinar. Allison, anything else, any other closing remarks or wrap up that we should address?
No, I think that's everything. Thank you all so much for sharing these wonderful stories and your wonderful insights. We are so appreciative here. And I think that this was a wonderful discussion. Thank you all so much for joining us.
All right. Take care, everybody. Have a good afternoon.